Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Sam Taggart. He's a retired family practice physician and a member of the Arkansas Medical Society. Dr. Taggart, thanks for being here today.
Thank you for inviting me.
So we're talking about the Medical Society and what it does. What does it do for Arkansas?
It started out of a way to seek professionalism. This was in the mid-19th century, 1970s, but it's professionalism. Back then, and even as today, there are an awful lot of people who call themselves doctor, and some suggest that they are medical doctors who really aren't. And the whole idea of the Arkansas Medical Society and the various county medical societies, the American Medical Association, all of that was an attempt at professionalism. To try, and just like you want when you call a plumber, you want to know your plumber is certified. You want to know your electrician is certified. Same thing with that's what the Medical Society was all about.
And you're celebrating a big milestone this year. Tell us what that is.
This is the 150th anniversary of the Arkansas Medical Society. The move to start it actually started 5 years before that. And they started a separate organization called the Arkansas Medical Association after the American Medical Association. But, you know, doctors tend to fight among themselves a lot. No, really. They tend to fight among themselves a lot. And for the first 5 years, they had this internecine warfare that went on over the qualifications of one particular doctor from Hot Springs, a Dr. Brooks. And they could not decide whether he was or was not qualified. And so finally, a group of doctors from the Little Rock area and one from Fort Smith broke off from that group and started the Arkansas Medical Society. That was in October of 1875.
And it's changed. It's changed quite a bit since then. What are the components when you say professionalism? What does that entail?
Licensing, education, and especially, I think licensing was a big deal, okay, because the licensing of physicians, the first attempt at licensing physicians in Arkansas was in 1831, and they passed it. The legislature passed it, and the governor vetoed it. He said the people ought to be able to decide who can be a doctor and who can't, and so they didn't pass another one until the part of what the Medical Society was formed for was to create some validity to all these things that were done. So almost immediately after the Medical Society was formed, the very first licensing body was created for licensing doctors in the state of Arkansas, and that was in about 1881. That was 3 or 4 or 5 years afterwards. And medical schools. Arkansas did not have a medical school when this organization was formed. And to be a member of the Arkansas Medical Society, you had to have graduated from a recognized medical school. Now, there were an awful lot of physicians in the state of Arkansas at that time. The vast majority of them had not graduated from a recognized, legitimate medical school. Most of them have done apprentice work, and then they've done 2 or 3 months of study with schools like in St. Louis and Nashville, some as far away as Philadelphia, some in Kansas City. And so to create a medical school, and then that's what they did. One of the first major significant acts related to professionalism, other than developing the organization, was to create a medical school. And that was about 6 or 7 of the guys got together in 1878, 1879. And then the next spring, they graduated the very first class with 1 student. His name was Pinson, Thomas Pinson.
And how long have you been a member of the society?
50 years. 50 years. Got my 50-year pin last summer. It's one of the things they say about medicine is that you don't have to be the smartest person in the world, but you need to be nice to people and stay around for a while, okay? And stay in the same place. Well, I stayed in the same place for 50 years. That's what the pen means. That's what the pen means.
And so is that what inspired you, just being right place at the right time, looking at resources? What inspired you to be a part of the society?
It was almost like graduating from medical school and staying in the state. You're going to be a member of the Arkansas Medical Society. Doesn't mean you're necessarily going to be active in the Arkansas Medical Society, but you're going to be a part of it. So that was part of it. That was part of it.
And how has the Arkansas Medical Society contributed to the improvement of healthcare in the state?
I think, okay, if you go back to the 1870s, one of the things about the 1870s, we were a very poor state. We'd lost a significant part of our work population, and we were plagued by 3 epidemics of yellow fever. Okay. The only thing you could do about yellow fever was to quarantine to keep it from spreading. Well, there was a lot of arguments about how to do that, who should do that. This brand new medical society who had formed in 75, and this was in 78, 79 that the second 2 yellow fever epidemics happened. Those guys were really strong. They're really strong people. And they put together first a Board of Health that could do quarantining for the Little Rock area, Little Rock, Pulaski County area. Then they did one for Fort Smith. And they wanted to do a statewide one that would get over and get West Memphis and Helen and all those areas where the yellow fever was coming from. They negotiated with the governor and with the legislature, okay? And because some really good negotiating, okay? They didn't have much impact with the legislature, but they did with the governor. And the governor was able to eventually declare their Board of Health the State Board of Health, okay? Now, back in those days, boards of health were temporary. They'd last as long as the crisis was going on. But that when that Board of Health was declared the State Board of Health, they then were able to limit the impact of yellow fever. Towns like Forest City and Augusta really got hit real hard. Augusta lost 22 or 23 people, and Forest City lost a whole bunch of people. But they were able to just pretty restrict it because of quarantine procedures. That gave the Arkansas, this new organization, some legitimacy, okay? Then when they sat down and started working on developing a medical school, now you remember the University of Arkansas wasn't developed till the early 1870s. And so they were able to convince the powers that be to make the new medical school, this new medical school they wanted to start it, which was a proprietary organization. This is owned by these 6 or 8 doctors, okay, as a part of the university. So it made it part made them a small part, not a very well-funded part, but a very part of it.
And so since then, what are the major milestones that you've seen that this society has been a part of?
Tons of them. They're just like this group of people. This group of people held sway in the medical society and in the medical profession in Arkansas for about 20 or 25 years. Then there was another group of guys came on, headed by a fellow named Morgan Smith. And in the late 1910, I think it was, I want to say it was in 1903, somewhere in that time frame. Morgan Smith and his cohort, that group of men, okay, and it was all men except for one woman. We'll talk about her if y'all want to in a minute, if you want to in just a minute. But that group of men did a ton. They got a real, honest-to-God licensing law passed in 1905, okay, that differentiated between medical doctors, osteopaths, chiropractors, okay? And that really had a major, major impact.
So does the AMS advocate for healthcare professionals and patients in the state? Is that part of the role?
That's part of what what we're talking about there. But yes, the Arkansas Medical Society has been on the side both of patients and the physicians, and it's been more important in rural areas. And of course, even now, 39%, we're one of the most rural states in the United States, okay? And even now, a significant part of our population lives in towns of 2,500 to 5,000, or still on the farm, so 39%. So it gives them a voice, and the medical society is involved in that.
And what are the biggest challenges Arkansas doctors face today, and how does the medical society provide support?
If there are any physicians watching this, okay, understand that I know that I've been retired for 10 years. Okay, I've been retired for 10 years. So for me to talk about what you guys are facing, but I think I do know some things, okay? I want to read you a couple of quotes that I think are important. There was a fellow at Harvard University in the first 3 decades of the 20th century. His name was Francis Weald Peabody. And he published a book. It was actually an essay that appeared in the American Medical Association Journal in 1927, right before he died, called The Care of the Patient. And one of his intention statements in that was, the secret to the care of the patient is caring for the patient. Okay? It sounds simple. It sounds too simple, but it's not, because it is. It's the essence of what we do. It's the essence of what doctors have to do. And if we ever lose track of that, it's a problem, okay? The other statement that speaks to the issue that we're talking about here is that the care of a disease should always be impersonal. But the care of the patient must always be personal. Okay? I think one of the things that bothers a lot of physicians and challenges them is that you spend a lot of time in the practice of medicine meeting the requirements of insurance companies, electronic medical records, those kinds of things, and less time with the patient itself. Medicine is, in some ways, and again, this is an old guy saying this, okay, becoming more impersonal than it was in the past. I hear this complaint from patients and from physicians, okay, that the impersonalization of medicine, okay. I have a good friend who is from up around Springdale, and he was one of the first guys to help create electronic medical records. His name is Randall. Randall was very actively involved in this in the late 80s and the early 90s. And I interviewed him for one of my interviews that I do here a couple of years ago. And he said things were going great with electronic medical records until about 2009 or 2010. And the bean counters took over the electronic medical record. And so the medical record these days seems to be becoming less of a patient care tool and more of an accounting tool. I don't think money is as big a challenge as it ever was in medicine. It was always a big challenge in the past. I don't think money's a big challenge anymore. It's this business of depersonalizing and moving from the care of the caring about the patient to fulfilling the requirements for funding. So those are the challenges, I think.
Dr. Taggart, thank you so much for being here today and sharing information about the Medical Society and all that it's done for the state of Arkansas.
Thank you.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.